When these companies start to distribute these medications, they must specifically state what form they're going to be manufacturing these in. And behind me are various forms of these medications. Let's review briefly what some of these forms may be. You've heard of some of them: tablets, capsules, film, ointments, creams, lotions, and they can also be in a liquid form, in a solution or a suspension. They can be in a powder. They can be found in suppositories, thermal patches, pellets, waters, inserts, and even gases. Let's look at some of the different routes and forms that these medications can have. Tablets are a very common form of medications. They are a solid form containing the active ingredient and then inert ingredients, which help to either hold it together or sometimes can help with the dissolving of that tablet as it goes to the GI tract, and that will affect the availability. They also provide bulk and establishes a standardized size. This can be abbreviated as either TAB, T-A-B, or TABS, T-A-B-S, and they come in different colors and shapes. There's different types. Some of them are scored, where there is an indented line from one side of the tablet to another that allows a person to cut that tablet in two and break it into two equal pieces. We're going to see a little bit more later about effervescent tablets, which are dissolved in a glass of water and swallowed as a liquid. And then you need to know about enteric-coated. Enteric-coated resist stomach acid, and they dissolve more in the alkaline environment of the intestines. And this means that there's going to be a delay in the time from when I consume it until the chemical starts to enter into my body. This is an example of a caplet behind me, and these are also enteric-coated. They're in the shape of a capsule, but they're a tablet, so they're called caplets. These are generally slow release or extended release forms. And these extended releases or delayed release are abbreviated with the letters C, D, CR, ER, LA, SR, XL, or XR. Lozenges are formed from the hardened base of sugar and water, and that base contains the medication and maybe even some flavorings. These are never swallowed whole. They are designed to disintegrate in the oral cavity to form a liquid that releases the drug rapidly into the mouth and into the throat. Troches are kind of oblong tablets, and they are also sugar-based, and they are also designed to dissolve into a paste to release drugs topically into the mouth. Earlier, we spoke of effervescent tablets, and behind me is an illustration of an effervescent tablet that is dissolving in liquid. This is a large tablet and needs to be dissolved before the drug can be taken orally. Many medications of this type that are useful for the aches and pains associated with common colds. Another form is called a capsule, and there's two types of capsules. There's one-piece capsules, which is a gelatin shell with liquid inside, or there's the hard shell, which is in two pieces, and inside of those are powders or granules. Behind me is an example of the hard shell halves with the powder or granules inside. These can also be in an extended release form, and these are sometimes abbreviated either CAP or CAPS. Here we have an illustration of an extended release capsule. And not only do you have the capsule, which will allow the ingredients to go into the stomach and then slowly be absorbed, that is broken down, but by the time this capsule makes its way into the intestines, it is only then that these smaller pellets are starting to be digested. So between the time the body has to eat through both the outer shell of the capsule and then the shells of the pellets within the capsule, a longer amount of time has taken place, and this delays the onset of the absorption of these medications. This is an example of a film. Films are thin, dissolvable substances that contain a dose of the medication, and they are usually taken either sublingually or buccally. That means on the tongue or underneath the cheek, inside of the cheeks. It enters the blood through the oral mucosa, which bypasses stomach and digestion, and that means that the chemical does not first pass through the liver. It is now more available to the body via the bloodstream. This is also suitable for pediatric patients, patients who have dementia, or patients who have difficulty swallowing. In this illustration, we see an example of an ointment. Ointments are semi-solid emulsions of oil and water. The oil is the dominant ingredient. These are absorbed into the topical area applied, and most of these ointments apply more of a local as opposed to a systemic effect. Creams are similar to ointments. They are a semi-solid emulsion also of oil and water, but in this case, water is the most dominant ingredient. There is an emulsifying agent that is added. This allows it to be absorbed into the skin. This elicits more of a local effect, a systemic effect. On this illustration, we see the difference between the different types of gels and ointments. You'll see the ointment on top and the cream on the bottom. And you can see that there's a difference of consistency and viscosity. Lotions are a suspension of drugs in a water base. They are absorbed directly into the skin. It is desired for local and not systemic effects. Most of these are over the counter, and they're mostly used for dry skin or irritated skin.